When it comes to our kids, building a strong, healthy foundation is, well, it's everything, right? And a huge piece of that puzzle is their bones. Today, we're going to talk about rickets, a condition that can seriously weaken that foundation.
Rickets. I know, it sounds like something straight out of a history book, doesn't it? Like a relic from a totally different era. But here's the crazy part, and honestly, it's a little concerning. It seems to be making a comeback. So the big question is, why now?
Yep, the short answer is it is. And that's exactly what we're here to do. We're going to dig into why this is happening, and, way more importantly, we're going to lay out the simple, powerful steps you can take to protect your child. So let's get right to it. Okay, so to figure out how to fight this thing, we've got to understand what's actually causing it in the first place. And it all kind of boils down to the body missing one single, absolutely crucial key. So what even is rickets? Well, at its core, it's a childhood condition that makes bones soft and weak. It happens when the body is starved of the essential building blocks it needs, and the main culprit is usually a long-term shortage of vitamin D.
But the how is what's really fascinating here. Probably the best way to get your head around it is to stop thinking of vitamin D as just a nutrient and start thinking of it as a special key.
It really breaks down into 3 simple steps. First, your kid eats food with calcium and phosphate. Those are the bone-building materials. Second, our special key, vitamin D, unlocks the door so the body can actually absorb all that good stuff. And third, the body takes those minerals and uses them to build a strong, hard skeleton. The bottom line is really simple. If you don't have the key, the building materials stay outside, and the bones just can't get strong. Okay, so that's what's happening on the inside. But what does that actually look like on the outside? What are the real-world signs a parent should be looking for?
Well, the most classic signs are in the skeleton itself. See, soft bones just can't handle the body's weight, which can cause things like bowed legs or knock knees. You might also notice a thickening or widening at the wrists and ankles, and sometimes you can even see little bumps along the rib cage, which has this old-timey name, a rachitic rosary. And hey, it's not just about the shape of the bones either. Rickets can throw a wrench in overall development. We're talking about being slow to walk, not growing as fast as they should, having dental issues, or even a kind of muscle weakness that can cause a toddler to waddle when they walk.
And in really severe cases, the problems can go way beyond the skeleton. This quote from the UK's National Health Service, their NHS, really puts it into perspective. A serious lack of calcium can actually lead to muscle cramps or even seizures. It just goes to show how vital these minerals are for the entire body. So that brings up a really important question. Who should be most concerned about this? Let's break down the main factors that make some children more vulnerable than others.
Generally, the risks fall into 3 main buckets. First, there's diet, what a child is or isn't eating. Second is sunlight, which is how our bodies naturally make their own vitamin D. And third is just plain biology, some factors that can make a child more susceptible from the get-go.
This table spells it out really clearly. Let's just walk through it for a second. Babies who are only breastfed are at risk because, as amazing as breast milk is, it's naturally very low in vitamin D. Kids with darker skin tones need more sun exposure to make the same amount of vitamin D. If you live way up north, you get less intense sunlight, especially in winter. And finally, things like restrictive diets or being born prematurely can also increase a child's risk. Okay, I know that might sound a little scary, but here's the really, really good news. Rickets is super preventable, and if it's caught, it's also very treatable. So let's talk about the game plan. If you only remember one thing from this whole explainer, please make it this number, 400 IU. That's 400 international units. This is the daily dose of liquid vitamin D that pretty much every major health organization recommends for all breastfed babies, starting right from the first few days of life. This one little step is, without a doubt, the most powerful prevention tool we have. Now, beyond supplements, our bodies are these incredible vitamin D factories. And while you always want to be smart about sun safety, you don't need a ton of it. For a lot of kids, just 10 to 15 minutes of sun on their hands and face a few times a week in the sunnier months is enough to make a real impact. And you knew we were going to talk about food, right? Diet is obviously huge. So on the left here, you've got your natural powerhouses, foods like fatty fish and egg yolks that are rich in these key nutrients. And on the right, you've got common foods that are often fortified with this stuff, things like milk, cereal, and orange juice.
Just getting into the habit of checking the nutrition label for vitamin D and calcium is such a simple, smart move.
But what happens if, despite everything, a doctor does diagnose rickets? The key thing to remember is that treatment works, and it works really well. It's all about replenishing the body's supply with doctor-prescribed supplements and getting some good nutritional guidance. For most kids, that's all it takes for their bones to heal and harden up, just the way they're supposed to. So, the takeaway here couldn't be clearer. Yes, rickets is a serious condition with some pretty concerning symptoms, but it is absolutely not a reason to panic. It is overwhelmingly a preventable and treatable problem. Having the knowledge and taking a few simple proactive steps is your best defense.
And that really brings us to the final, most important thought. This isn't just about preventing one disease. It's about building the very foundation our children are going to stand on for the rest of their lives. And when you realize the key is as simple as a few drops of a vitamin or a little time in the sun, it makes you ask the real question, are we doing what it takes to turn that key for them? Thanks for watching.